This conference will now be recorded.
All right, folks, so we are in chapter 6, and we're finishing up chapter 6, looking at just the very last slides regarding the integumentary system. At the end of this presentation, I'll just do like a review a bit of chapter 6, and then I want to show you again, re-show you those two videos that we worked on tonight. So I want to reinforce it with you all, okay? So we'll do that there. So let's look first here as far as vitamin D synthesis is concerned. So your exposure to UV light, right, from the sun, it activates the precursor molecules that will initiate vitamin D synthesis. Very important. You'll notice, folks, that during the wintertime, when you're not out in the sun as much, can you feel a little down, a little blue? Can you feel a little tired, right? This is all as a result of the lack of vitamin D that you're not getting in your diet, unfortunately, and you're not getting as a result of, because we're vampires and we're indoors most of the time, right? But summertime, you go to the beach or you go outside to someplace and you're out in a field and it's sunny. Do you not feel good, right? You do. Yeah, and that's vitamin D plays a role in that. And it aids in the absorption of calcium, right? It's very important for bone growth, for immune function and such. Vitamin D is essential, folks, essential for us to live a healthy life. You'll see here, as far as this next, so folks, the importance of indeed vitamin D, misshapen bones due to calcium deficiency, and again, vitamin D is important for, and calcium and vitamin D very important as far as their role in absorption. Look at what goes on. Bones are weak due to lack of calcium, may develop into osteomalacia, this bone softening present in adults, right? You'll see here as far as the rickets and also, what's the other one there? Oh, it'll come to me. No, and it's not osteopenia or osteoporosis. It'll come to me. Vitamin C deficiency. It's for scurvy, right? So these can affect you. Your teeth can fall out. You ever see like the pirate movies and they're having issues with their teeth? Why do they have a barrel full of apples? To prevent vitamin C deficiency as far as scurvy. But here we're looking at rickets and such. And so both can affect what goes on as far as skeletal system is concerned. Okay. Let's move on to as far as healing that's taking place as far as in the integument and such. So the skin, highly vulnerable to injury. And as a result, what has the body done? The body has allowed for very multiple layers of the stratified squamous epithelial tissue of the epidermis keratinized. So there's multiple dead layers of the epidermis, right? On that stratum corneum, right? Remember that. So it can take these abrasions, cuts, and burns and such, but prone to them, right? Very, very vulnerable. We don't have so like armor plating on our skin, right? We do not, right? So as a result, it's just a matter of that multiple layers can help with the getting injuries and not not being so devastating to what's underlying as far as our bones and as far as our organs and such, but still prone to injury. So highly regenerative, and this is important, right? So that remember that basal layer of the epidermis, that basal layer, single layer of mitotic cells. And this is continually producing new cells that are pushing outward, right? Out to the different layers and out to that stratum corneum in particular, that's the dead layer of the epidermis, right? Highly regenerative. Wound healing may lead to scars, okay? And also depending upon how deep the wounds are, can they damage what goes on as far as the hair and glands? Can you damage it so bad that you don't have any issues as far as to be able to grow hair in certain areas of your skin as a result of the damage to it and the scarring that takes place? Absolutely. And repair tissue, different texture and consistency. This is true. Burns, think the rule of nines. The rule of nines for the burns, and we'll see that in a moment, but that should just come right away, the rule of nines. So you'll see here, we can have heat, radiation, electricity, or chemical burns. These can all result in different types of burns, okay, as far as their etiology, but all can be very damaging. So you'll see here, first degree, second degree, third degree. So first degree, epidermis, second degree, epidermis and dermis. Third degree, epidermis, dermis, which is your skin, and then that supportive tissue, that hypodermis, also known as the subcutaneous layer. So when we have third degree burns, we would need to then have some type of grafting taking place, okay? Because you've removed any of these cells that are going to be able to renew and it's going to really, third degree burns are quite devastating. Here we're seeing an image of the first degree, second degree, and third degree. Again, first degree epidermis damage, second degree epidermis and dermis layers are damaged, and then third degree affecting all the way down deep into that subcutaneous hypodermis layer. So here we have the rule of nines, right? So the rule of nines, so the head and neck, 9% as far as if they are burned. So the size of burn is important in determining treatment, okay? And understand that really holding on to really dehydration can take place depending upon the severity of the burns. And if you've ever known someone or in your family or just friends or whatever, but people that are suffered from severe burns, infection is a major key also as far as a major issue that can take place. Head and neck, 9%. Each of the limbs, so 9%, 9%. The trunk, 36%. The genitalia, 1%. And the lower limbs, 18% each. Okay? Add those all up and you come up with 100%. And so I'll tell you, I don't know if you've ever had the opportunity to see any information regarding folks that have had face transplants. That is some pretty amazing stuff that they're able to do. Now, the technology for that has advanced so much. I remember seeing early face transplants and then those that are more recent. And the more recent ones, I'm telling you, it's remarkable. Now, you have to understand also that depending upon what goes on as far as the level of damage that we're starting off with can also affect the outcome at the end. Okay, so, you know, face transplants, amazing stuff. And so you know, folks that have burns through a good portion of their face, to be able to go through a face transplant is amazing. Now, I recall one transplant where gentleman had electrical burns and he ended up becoming blind as a result, and bad damage to his face and such. So he looked it was pretty devastating. And yet, so he ends up getting the face transplant and he's able to wear glasses to cover, you know, the areas where he's blind. So it didn't, you know, we weren't able to give him new eyes as far as that we're able to see. So, right, so he was still blind, yet his face looked quote unquote normal, you know, which is quite remarkable. I'll get your question at the end. Okay. Yeah. So let's move on. So wound healing. So you'll see here that multi-step process, this makes sense, right? So you have blood clotting, it needs to take place first. And we all get this, right? We've all cut ourselves. And so if you don't clot, are you going to continue to bleed? Absolutely. And know that hemophilia is a situation where we have missing clotting factors that prevent a patient from really clotting well. And this can lead to some major bleeds internally and such. From you or I can bump up against something and maybe get a little bit of a bruise, but they can have a bruise that continue to bleed and be a major problem for them. Fibroblasts. So remember fibroblasts, these are cells that are going to produce what? Fibers. They're synthesizing fibers. So fibroblasts produce new collagen, also known as granulation tissue. This will then lead to regeneration of the epidermis. Excuse me. Pardon me. Sorry, folks. All right, and so then scar may form after healing, and well, depending upon, you know, you can get different salves, You can get aloe, different things that can help with the healing process to minimize scar formation. Skin cancer. So you'll see here, most commonly associated with overexposure to UV radiation. And so our body does what it can to increase melanin production to cause a darkening of our tissues, of our skin, in order to protect us from the UV rays from the sun. Right? You'll see here that UV radiation can cause mutations in DNA, and this can lead to also issues that can be cancer risk. They depend upon the cell where the cancer is originating. So you'll see here, going down there, so basal cell, squamous cell, which would be then the keratinocytes of the stratum spinosum, right? So you've got come, let's get sunburn, right? So that right at that, the basal layer, right above the basal layer is the spinosum layer, okay? And then you have then melanocytes. So these different, depending upon the cells that are affected, are what you're going to have as far as the diagnosis of the cancer that we're talking about there. So basal cell, deepest layer, the spinosum cells, right, for the squamous cell, and the melanocytes for the melanoma. Now we're going to see here as far as basal cell carcinoma, right, that stratum basal, the very inferior aspect of the epidermis, the mitotic layer. Most common cancer in the United States is basal cell. Squamous cell and melanoma, you'll see here. Squamous cell, more aggressive and can metastasize, can go from not only just to the skin, but to other areas of the body, and that's not a good thing, because that can lead to then spread throughout the body, and that would be very bad. And then melanoma, this also difficult to detect and highly metastatic. Okay, so out of all of them, melanoma can be the most aggressive and people die as a result of melanoma each year. All right. Okay, folks, very good. So there's the summary. And so now I'm going to end the video because we finished the slides, but we're going to do some review.